Losing weight, so easy. Okay, no, it's hard. It's so hard. And some people spend a lifetime on what can be a journey of ups, downs, disappointment, and health complications.
While drugs are extremely popular right now, they're not a permanent solution. For certain patients, surgery can bring significant weight loss and improved health. In our weekly wellness segment today, we're talking with Dr. Eric Crable. He is the Director of Bariatric Surgery for Trinity Health Grand Haven and Grand Rapids. Doctor, thanks so much for being here.
Yeah, thanks for having us.
Let's talk about bariatric surgery in general. What it is, because I think there's a lot of different options that people don't necessarily understand what that entails.
Yeah. So bariatric surgery is it's a specialty in its own right, really specializing in minimally invasive surgical techniques where we are attempting to change the digestive tract and using that tool along with some of the extra added things that are needed. So paying close attention to healthy food choices and options, and also maintaining activity as well.
And the bariatric surgery, the end goal, what are your patients, what results are they wanting to see?
Yeah. So obviously the top of mind thing is losing weight, right? But when we really drill down on what the root cause of many health conditions are, it is obesity. So obesity is a big problem in the United States. Here in the state of Michigan, it's really considered, top of the health concerns that we have. Upwards of 40% of patients are struggling with obesity, but the weight is not the only issue, right? It's trying to help with all the other conditions that go along with that. So high blood pressure, high cholesterol, type 2 diabetes, and sleep apnea. Those are things we're trying to solve to get patients healthy.
Sure. And not everyone qualifies. So let's talk about who would be an ideal patient for this kind of procedure.
So it really begins with the BMI, so body mass index, which is really just a ratio of patient's height versus their weight. If you have a BMI of 40 or greater, you'd be considered a candidate for weight loss surgery. However, we also kind of lower that BMI down to 35 to 40 with patients that have some of those health conditions like diabetes or high blood pressure, and that's who we're trying to help.
And a lot of people on the weight loss journey are, I'm sure, being bombarded now with commercials about Ozempic and glutathione's shots and things like that. Can you speak to that as well?
Yeah. So it's been an explosion in popularity, I would say, in the last couple of years. They have their set list of indications, maybe. So while surgery is not for everybody, and like we just talked about the indications, those medications aren't necessarily for everybody as well. The best use of them is going to be in a patient maybe that is struggling with obesity, so that BMI range, maybe in the 30 to 40 range. 40 and above, surgery, we're going to see some better results. But adequate use of these medicines really should be done in partnership with your healthcare team. So it very much is a multidisciplinary effort, and a lot of the good results we've seen with these medicines, along with surgery, really comes with interaction with those providers like dietitians and exercise physiologists.
Absolutely. And then let's talk about the results and what some patients see. I mean, a life-changing experience for these people.
Yeah, that's certainly it's the reason why I do this, right? Is to get those results for patients. It is a journey, right? There's a lot of touch points that we have with these patients along the way. The amount of weight that you can lose with surgery can be significant, right? Upwards of 60 to 70% of the extra weight somebody's carrying around, we can help them lose in the course of a year. It's why we do it.
Yeah, but I can only imagine somebody listening to you right now saying, wow, this time next year, 60 to 70% of this extra weight gone.
Yeah.
I mean, it's got to feel pretty good.
We're really aiming to get those little victories. It's not always about that number on the scale. It's a good motivator, obviously, but it's being able to move easier, do what you want to do, be with your family, play with the grandkids. Oftentimes those are the motivating factors we have here.
Absolutely, and just feel better, right?
For sure.
So if people, this sounds interesting to them, and they think that they might be a candidate, can they just come and see you? Like, how does that work?
Yeah, so there's a lot of ways to find us online nowadays. It's as easy as ever. So Trinity Health, find me through the website, finding the bariatric website, and then finding us, getting to a doctor's office to speak with us. Your doctor can refer you directly to our clinic. And again, it's a comprehensive center, right? We're taking care of everybody that is struggling with their weight. We're here to help.
Absolutely. No matter where you are on that journey, maybe just beginning, maybe you just got that BMI report and you're like, hey, I got to do something. Well, see if you qualify for bariatric surgery. And you can visit trinityhealthmi.org for more information. Thank you so much for the time, Doctor.
Yeah, thanks for having us.